Right, so today we're going to start our muscle lecture. We're going to do the muscles of the face, the head, and the neck. These are the muscles that we are going to cover, but we're going to go into each of them separately. So looking at the first one, you have what's referred to as the occipitofrontalis. That's actually going to be the occipital or occipitalis, which is going to be at the back of the head, which you don't see yet. You will see it in a little bit. And the frontalis muscle, which is going to be what goes across your forehead. And it's attached through an aponeurosis, which is going to be a sheet tendon, which attaches both of those. And you can see that sheet tendon, hold on just a minute, up top here. And so that's going to be that tendon, and that's going to attach the back of the head muscle to the front of the head muscle, and they work together, and that's going to help move that one. So with the frontalis, let's start off with it. It's actually going to be located over top of the frontal bone, and it's going to help raise your eyebrows and wrinkle your forehead. And that occipitalis is going to be at the back of the head. It's over the occipital bone, and that's going to help draw the scalp posteriorly. Next, you have what's referred to as the levator labii superioris. This is also going to be known as the quadratus labii. This is going to help contribute to facial expressions and movements of the mouth and upper lip, and its primary function is to elevate that upper lip, so to help bring that upper lip up. Next, you have the zygomaticus major, and that's going to be the large one here, but you also have what's referred to as the zygomaticus minor. So you do need to know both of these. With the zygomaticus major and minor, they're going to be attached or on the zygomatic bone, and they're going to come down and attach to the edge of the lip right here, and that's going to be the orbicularis oris. And when it attaches there, what it's going to do is help draw that mouth upward and help with like a smiling, laughing, or just simply raising the lips motion. Next, you have the depressor anguli oris. The depressor anguli oris is actually going to depress the angle of the mouth, kind of like what it says. This is going to allow you to turn the corners of your mouth down when you're unhappy. Next, you have your orbicularis oculi. With the orbicularis oculi, this is going to be located at the tissue of the eyelid and a medial orbital wall, so it goes around that eye. It is a circular muscle, so any of these orbicularis muscles are going to be circular, and this is going to help you to close your eyes. Next one that you're going to have here is going to be the masseter. The masseter is going to be one of your muscles for mastication. Mastication is actually going to be the chewing of food. It's going to be a very powerful, superficial, kind of quadrangle muscle that's going to originate from that zygomatic arch. And then it's going to come down and insert into the angle and lateral surface of the mandibular ramus. And so that long section of the mandible that you studied when we went over the skeletal system. And so this is going to help to chew and help to move that jaw there. Next, you have the orbicularis oris. The orbicularis oris is going to be the skin of the lips. It goes around the nose and between the lower lip and chin. This is going to help close. It also helps protrude the lips. It's going to help compress the lips against the teeth, and it's going to help shape the lips during speech. So this muscle is going to be very important doing all of those things and controlling your lips. So next we're going to be looking at the side of the head. Over the temporal bone, you have your temporalis, and it's going to help to elevate and retract the mandible. There you see the masseter again. And so that's going to be that muscle of mastication attached there at that mandibular ramus, coming from that zygomatic arch. It's going to help you chew. Then you see up here the epicranial aponeurosis. The epicranial aponeurosis is going to be a sheet-like tendon. Any aponeurosis is a sheet-like tendon, and that's simply going to attach two muscles together. So it's going to attach, hold on, second, this frontalis muscle to the occipital muscle, and that's what helps us control both of those together, and we call it the occipitofrontalis. There you see that zygomaticus major, and again, right above it, slightly smaller, is that zygomaticus minor. Remember, it's attached to the zygomatic bone. It draws that mouth upwards and helps you smile and laugh and move that upper lip. And there you see again the depressor anguli oris that helps bring that mouth down or depress it down, helps you make a sad face, helps you kind of really flex that lower chin. Next, we're going to move on, and we have what's referred to as the platysma. This is going to be a broad sheet muscle that's going to extend from the collarbone to the jaw, or the jaw down to the collarbone. It's going to help pull the mouth down and help pull it out if you need to. This one is going to be used if you are showing sadness. It could be used in surprise or horror. It's used when you frown. It could also be used in smiling, kissing, or even in anger. So it's an expression muscle. Now coming in to the inner part of the cheek, kind of underneath that masseter, you end up with the buccinator. That is going to be attached from the maxilla to the mandible, and it's going to help to press cheeks against the teeth. And so that's going to help keep the food in the mouth and from falling out when you're chewing food or during mastication. So it helps press those cheeks against the teeth and the lips and helps with chewing, basically, with your food. Now going underneath the neck section here, we have what's referred to as the digastric. This is going to run under the jaw, and it's going to help open the jaw. It helps with swallowing and chewing and speech. It also helps to stabilize the hyoid bone while swallowing to keep the airway open. Then we're going on, and you have what's referred to as the omohyoid. This is going to depress the hyoid or bring the hyoid down. So notice how it's attached to that hyoid bone and then comes in and attaches lower and helps bring it down. Going to the next one, we have what's referred to as our sternocleidomastoid. This is actually going to start at the mastoid process up in the head. So we have it here at this mastoid process. It's going to come down and it's going to attach to the sternum and into the clavicle section of the chest. And so with the sternocleidomastoid, it's actually going to help rotate the head to the opposite side. And so they can work together. You have one on each side, so it can help you turn it to the left. It can help you turn it to the right. And it helps you keep your head in a fixed motion and helps elevate that sternum or bring the sternum up. Next, you have what's called the mylohyoid. That's going to be essential for swallowing and for speaking. It's going to go from the mandible, where it's going to have its origin, to the hyoid, where it's going to have its insertion. Then you have your sternohyoid. This is going to attach the hyoid to the sternum and also helps depress the hyoid. So these work together in pulling that hyoid down to help you swallow. And there you see the omohyoid again. That's sternohyoid. And moving on to the back of the neck. So at the back of the neck here, you have the trapezius. Notice how it has that triangular shape or almost like a diamond shape, and it does go across both sides of the back. With the trapezius, you're going to have a cervical and thoracic vertebrae attachment. It's also going to attach to the occipital bone. It attaches to the clavicle and to the scapula. So all of those bones are where it's going to be attached to. It's actually going to help you to rotate, adduct, depress the scapulae, and extend the head. So the scapulae is going to be that scapula underneath. Next, you have what's called the splenius capitis. This is going to be located at the vertebral column, at the back of the occipital and temporal bone. So you see all of those, it comes in and attaches at the vertebrae. What it's going to do is rotate the head to the opposite side, and they work together to do this, and it also does help extend the head as well. Next, we have here the levator scapulae. Now with the levator scapulae, it will be referred to as a posterior axioappendicular muscle, and what that basically means is it attaches the axial skeleton to the appendicular skeleton. So it's a muscle that's going to attach those two together. And so it's going to connect basically the upper limb to the vertebral column, and it's going to lie in the posterior triangle of the neck. So it's going to be at the back of the body, or the dorsal section of the body. And the superior aspect of the levator scapulae is going to be covered by that sternocleidomastoid, and it's going to be underneath its inferior part of the trapezius. And what it does basically, when you see it there attached to the scapula, it's going to help to bring that scapula up like you're kind of shrugging your shoulders. So it can help pull up. Next, we have what's called the semispinalis capitis. The function of the semispinalis capitis is going to help the head and the neck extensors. And so it helps extend the neck at the end and helps you contract it bilaterally. And so it helps you move the head around. Next, you have the rhomboid major and rhomboid minor. Notice that you do have two of those there. They help with the cervical and thoracic vertebrae, is where they're going to be located, and they're going to elevate, adduct, and rotate the scapula. And so sometimes when you go to get your back massaged or rubbed, this is going to be one of those muscles that feels good when they're massaging it, because it does tighten up sometimes. So here you're going to see several of them. You have that rhomboid major, which is going to be the larger section here. You have the rhomboid minor, which is going to be that section there. Okay, and looking, you have that supraspinatus. Exit this. You have the deltoid. That deltoid is going to be that arm muscle. That's going to be a safe place to get an injection if you have to go and have some type of immunization or some type of shot. The deltoid muscle is a safe muscle for an injection. Now we'll cover that one again when we get into the arm muscles. So we talked about the deltoid really quick. It's actually attached to the clavicle, humerus, and scapula. And what we use it for, other than putting injections in, for movement-wise, is going to help with abduction and flexion. It also helps with medial rotation and extensions and lateral rotation of the arm. So it's going to help move the upper arm around. Next, you have your latissimus dorsi. Lots of times people refer to these as their lats. Now with the latissimus dorsi, it's going to be attached at the humerus, thoracic and lumbar vertebrae, and pelvic girdle. It's going to help extensions, it helps adductions, and medial rotation of the arm. Next, we have what's referred to as the supraspinatus. It's going to be a relatively small muscle of the upper back, and it's going to run from the supraspinatus fossa in the superior portion of the scapula, or that shoulder blade there, to the greater tubercle of the humerus. Now with that, it's going to be one of your 4 rotator cuff muscles, so it's actually going to help you to abduct the arm and shoulder and to move it around. And then we have the teres major, and of course underneath or over to the side you have a teres minor, and so that's going to be attached to the scapula and the humerus. So you see how it goes from the back scapula over to the arm, and it's going to help with extension, adduction, and medial rotation of the arm. Going over to the front, you have the pectoralis major. Now the pectoralis major is going to be the larger muscle over top. Underneath you'll have the pectoralis minor. It's going to be attached to the ribs and the scapula. It's going to help with abduction and helps rotate the scapula and helps the scapula stay fixed. It also helps elevate the ribs and helps with inhalation. Going through the center, you're going to have a thick attachment point. This line is going to be called the linea alba, which basically in Latin means white line because it's made up of a fibrous connective tissue that's going to be found there. And so it's going to run down the front of the abdomen. And so it's going to help separate the left and right sides of your rectus abdominis. And so sometimes you'll refer to that as your 6-pack. Next, going into the body, you have what's referred to as the external obliques. With the external obliques, it's going to be located in the lower ribs, the pelvic girdle at the iliac crest, and its action is going to be lateral flexion and rotation, and also it works with the abdomen to help flex. Then you have what's referred to as the serratus anterior or serratus anterior. With this muscle, it's going to be more of a fan-shaped muscle. It originates on the superior lateral surface of the 1st to the 8th rib, so that's why you see them coming down, being attached to the ribs. And then the 9th rib, sometimes the lateral wall, and the thorax will insert along the superior angle or medial border and the inferior angle of the scapula. So with this one, basically it's going to help to pull that scapula forward and move the arm. Next, we have the rectus abdominis. This is what lots of people often refer to as their 6-pack. It's going to be 2 flat parallel muscles that are going to be separated by that linea alba. The main function of the rectus abdominis is to move the body between the rib cage and the pelvis. So the external oblique muscles are going to be there. These are going to be on each side of that rectus abdominis, and they're going to allow the trunk to help twist. But the 2 opposite sides, whichever external oblique is going to be contracting, will help the other side move. Next, we have that transverse abdominis. This is going to work along with other core muscles, and its main role is going to be to help protect those internal organs. It holds them in place. It helps support the torso, and basically keeps that tension in the torso wall to help stabilize the spine and the pelvis before any movement of those limbs occur. So that one's actually going to be the innermost one that you see there. So the rectus abdominis is going to be the 6-pack. You're going to have to the side here the external obliques. Then you're going to come in. You have the internal obliques, and then all the way inside, underneath that, the 3rd layer in there is going to be that transverse abdominis. And then we have our internal oblique there. So looking at the internal oblique, it's going to actually help with forced expiration. It's also going to help with things like defecation. So it's going to help you to contract and to push down within the intestinal wall. And so that's going to be a very important muscle. And it's also going to help protect that core center. And here, just looking at the inside. Sorry about that. So this just shows you that linea alba. It shows you that internal oblique and the transversus abdominis. Here, showing you the trapezius coming down. It's showing it attaching to that clavicle and also attaching to the scapula. Here's your pectoralis minor. That's going to be underneath that pectoralis major. It's actually attached there with the ribs. And you see the levator scapulae. And so with the levator scapulae, it's going to help to do what it says, help to levitate or pull up on the scapula. Right, and so we're going to stop here and we'll pick up with our next set of muscles with the next video.